Do you know someone in foster care? Have you been in foster care? Do you have a child in foster care? Are you a grandparent or relative caring for a family member? Are you considering becoming a foster parent? Then tune in every Wednesday at 3 p.m. to Fresh Start Today on WNOV 860 AM to engage in thought-provoking conversations with families and providers about child welfare services, both locally and nationally. Together, we can save our children.
Good afternoon. You're listening to Fresh Start Today. I'm your host, Jermaine Reed, and I have in the studio with me today Mr. Sean Roby, Master Level Social Worker. We have the blacksmith himself, Dr. Ramel Smith, and we have the Executive Director of the African Breastfeeding Network, Miss Dalvery Blackwell. Good afternoon, panel.
All right.
Hello.
Thank you for having me. And it's the African American Breastfeeding Network.
What did I call it? The
African Breastfeeding.
Oh, African. Same
thing. I know it's the same.
Black breast. What?
I just wanted to make sure that it's AABN.
It's AABN, African American Breastfeeding Network. And this is an exciting month and week because it is the National Breastfeeding Awareness Month. But this week, the 4th week of August, is the National Black Breastfeeding Awareness Week. So we're going to learn a lot today regarding understanding the benefits of breastfeeding for the baby and young parents. And so hopefully we'll be focusing on the young population because of teen parenting, and there's young children and adolescents young adolescents who are in foster care who have babies, and so we want to make sure that we can educate that young population. But I'm sure there's some things that we're going to talk about that's universal that can apply to an adult population as well as a teen population. Mm-hmm. So before we do that, I'm going to talk, just share a couple of announcements. We have a back-to-school fashion show and movie night that's on August 29th, Saturday, from 11 a.m. and 2:30 p.m., and that's going to be at Hapatha Lutheran Church. So that's a family-friendly event. That's on August 29th from 11 a.m. to 2:30 p.m., 1720 West Locust Street. There will be a Christian family charity event at, what is this, the Horny Goat Brute Pub? How the Christians going to be over there at the Horny Goat, Lord? Sunday, on a Sunday, August 30th from 10 a.m. to 4 p.m. Maybe they're going to be witnessing or something, I don't know. And then the Parenting Network is having Welcome Baby. That's going to be on Thursdays, July 11th through August 27th. So I think this is the last Thursday from 10:30 till noon. And so if you want to get in contact with them, you can call 414-671-0566. And then we also have the curriculum Dad Matters 24/7 that the Parenting Network is offering on Saturdays from 10 a.m. to 11:45, and the address is 7516 West Burleigh Street, 414-671-0566. And is the African American Breastfeeding Network doing anything this week?
Yes, we are. In recognition of the Black Breastfeeding Awareness Week, we are having something on Saturday with mothers and babies and families in the larger community at Johnson's Park. The address, let me pull up on my phone. The address is 1919 West Fond du Lac Avenue. Ready, set, lift every baby. We're AABN and our partners and families and women, mothers, babies are going to gather at the park to lift our babies in good health and healthy communities and breastfeeding.
And when is that?
That is Saturday, August 29th. We will start registration at 1:30 and at 2 o'clock. Actually, this is a national event, so around the world at 2 o'clock p.m. Eastern Time, communities around the world are going to lift their babies.
Oh, wow.
And support it. So we're really excited about this.
So that's something everybody can do. It don't cost any money. You don't have to march. You don't have to pass legislation. You don't have to get 5,000 signatures. You just need to lift a baby.
Lift your baby.
Lift your
if
baby
it's not your baby, it can be somebody else's baby. It can be a 3-year-old baby.
That kind of reminds me of that Roots scene. You see what Kunta Kinte lift up the baby?
Yeah. So
oh, yeah. We're going to lift the baby at 2
This is
p.m.
our first year, so we're really excited. We have a photographer who's coming, and so we're really excited about this. Actually, we have been celebrating all month.
Wow.
We started with a Best Breastfeeding Employer Supported Time Recognition Program, encouraging work sites to support breastfeeding and lactation programs for women in the workplace. We participated in a walk earlier this month, and also I want to announce in August, we also had our community breastfeeding gatherings. And that's something that AABN, we offer breastfeeding community gatherings every month at 2 locations, Park Lawn YMCA and Northside YMCA. And we usually focus on a specific topic. So we bring pregnant mothers, breastfeeding mothers, their supportive family members, community members, lactation experts all together to learn how to have increased breastfeeding rates and encourage women to be confident when they go into the hospital, because that's really important.
That's beautiful.
All right. And then we also have the Black Child Development Institute, National Black Child Development Institute, We the People. They're having a 45th annual conference on October the 17th through the 20th, and folks that can get registered. If they call 414-351-1100, we can give them more information on how to get registered for the National Black Child Development Institute National Conference. And then there's a recruitment fair Manpower is hosting on September the 4th, Friday, September the 4th, from 10 a.m. to 12 p.m. And there's a number of positions available: machine operated, packaging operators, machine warehouse, data entry clerk, customer service rep. So you can give Frederick Nelson a call over at, Department of Workforce Development, 414-267-3288, 414-267-3288 for more information. So let's jump into this topic. It's a very important topic. Again, this is National Black Breastfeeding Awareness Week, and we have with us Dalvery Blackwell, who is the executive director. So again, thank you for coming on, Dalvery, and Dr. Smith and Sean Roby. So we know that Wisconsin has a high teenage pregnancy rate. We've known that for a long time. And in fact, one of the highest in the country, and teen mothers face many challenges to successful breastfeeding and are less likely to breastfeed than any other population in the U.S., teens versus older adults. And this is due to coping with stigma, embarrassment, just related to possibly being a teen mother, or lack of parenting readiness, need for peer support. A number of these factors can contribute to why younger mothers are not participating in this very important activity called breastfeeding. And so we're going to talk today, and we know there's a lot of things that are true about breastfeeding. One, that breastfeeding is the best nutrition for your babies. Now, would you agree with that?
Yeah, I think that the general population understands that, and mothers know that they're going to make milk, and they agree that some mothers do agree that breast milk is better than formula, but believe it or not, some mothers think that formula is just as good as breast milk, and that's not the truth.
And we'll get into that. You know, what the difference is, the pros and cons of breastfeeding or formula versus breastfeeding.
But for general, yeah, I think that because of the national campaign and even local, the work that we're doing in Milwaukee to increase the awareness, women are receiving this information from their doctor's offices, from WIC, about the value and benefits of mother's milk. So I think that the awareness is increasing. And I think we need to focus on duration, exclusivity of breastfeeding.
Okay, and we're going to talk about some of the benefits, the health benefits of breastfeeding. And then also we also know I think one of the major health benefits is that breastfeeding counters obesity.
Yes. Okay,
so we'll talk about that. So, that's going to be great. So let's begin this discussion. I got a couple questions for you, Dalvery. And one is kind of talk about what is your organization, what it is that you all do, and how can folks get connected with you all?
Okay. So the African American Breastfeeding Network was formed, believe it or not, 2008. So we've been around for a long time. We met in the home of Angie Wilkes Tate, who is the WIC director at the MLK, Milwaukee Health Services. I hope that she's listening and doesn't mind that I offered this information. So we met in her home to address the issues of low breastfeeding rates in our community, because we know that women were not breastfeeding. When I became pregnant, I automatically knew I was going to breastfeed. No one had to tell me. I never saw it.
Okay.
It was just like, okay, I have these breasts. I know I make milk, so I'm going to use it for that purpose. I knew no benefits or anything. But what I became really disturbed with was that I didn't see these messages in the clinics, in my doctor's office. I didn't see women breastfeeding in public. And I was maybe naive, because I thought that women breastfed. I thought that women felt comfortable breastfeeding in public. And so I got involved right away and with determination to really change the way that we're thinking. But the African American Breastfeeding Network, our work is just designed to increase awareness, to come together with partners and advocates to really look at barriers in our community and how can we help women have breastfeeding success. If we look statistically at the data, looking at infant breastfeeding at 6 months and exclusivity rates, for example. So for white mothers, the breastfeeding at 6 months is 44%, and it's 46% for Latino mothers, but it's only 27% for African American women.
Is that national?
That's national data,
Okay.
but the national data mimics the local data as well. So the initiation rate, which is when women offer a breast or breastfeed in the hospital. That's what we call the initiation rate, breastfeeding in the hospital. Whether they use, it doesn't define if they use formula and breastfeeding, but they initiate it in the hospital, right?
Okay.
The initiation rate nationally is 70%.
17 or 70?
70. I know people, 70%.
Okay.
And in Wisconsin, it's like 76%.
Okay.
So we have a great initiation rate. Women, like I told you before, they're learning about breastfeeding. As a community, they're hearing more positive messages about breastfeeding. They are attempting to initiate breastfeeding in the hospital. So they leave breastfeeding, but the issue is when they get home. But that's when the problems really occur. The embarrassment around breastfeeding, around brothers and sisters just the issue of dealing with breastfeeding issues like engorgement or nipple pain, or not having access to a community-based lactation consultant who will come into the home like we do. You had asked earlier what AAB and what we do, and so we have 2 breastfeeding peer counselors. They do home visits, they do hospital visits, they do phone counseling, and we have 1 father peer advocates. Because at our community breastfeeding gatherings, we learn right away and immediately that fathers and mothers it's not productive to have them in the same room talking about breastfeeding, unfortunately, at this time in history.
Okay, hold on, right there. One thing I forgot to do is invite the callers to call if they want to join this conversation, 414-444-5250.
So
414-444-5250. But before I want to go back because you're saying, you said a couple things I think is really important. One is that there is a drop off from the time that the initiation starts in the hospital, and how long do folks stay in the hospital nowadays when they have babies? 3 days. I thought it was like 3 hours now. So
insurance companies want to get you in and out. Yeah.
So within 3 days, there's something that happens from being in this environment where it's acceptable, is taught, is embraced, is encouraged, meaning the hospital environment.
In some hospitals.
So some hospitals are breastfeeding
friendly
already.
Ready.
Okay.
Some nurses and hospital staff have education and been trained around lactation support. Most hospitals have international lactation consultants. So some hospitals are friendly and some are not. I've been in hospitals where I have witnessed a nurse giving a formula bottle to the baby, feeding the baby with formula, a newborn baby with formula in the hospital. Inappropriate. And also giving moms, especially breastfeeding moms, those formula bags upon discharge.
Okay.
So those subliminal messages are playing in their mind that my milk is not as good as this formula these messages. So there's a lot.
So we need to do some work around making hospitals more breastfeeding ready and friendly. Okay, but you said when they go home. And so the question I have is, how important is family support and friend support? And I'm wondering if your agency incorporates the entire family in educating them on the importance of breastfeeding.
I love your question, because we first started off, we called our group Sister to Sister Chat. But we started to see grandfathers, grandmothers, best friends come into our session, so we quickly changed it to the community breastfeeding gatherings.
Okay.
And that's exactly what it is. We encourage mothers, when they come to our gatherings, to bring someone with them. And interesting enough, what we're seeing is that every time a mom comes, and on average she comes twice while she's pregnant, come to our sessions.
How long are these sessions?
They're usually the educational piece is about an hour, but we offer dinner on Thursday, so it's really like a family affair.
Is it a cost to this?
No, it's free.
It's free. Okay.
So the moms, the interesting what I want to share with listeners about our motto and what we do is engaging the entire community and the families. That when mothers come to our gatherings, the first time they may bring the father of their baby, and then we have a father peer advocate who provides the educational piece. But the second time, she will bring someone different.
Okay.
And that's what we want to see. We want to see mothers go into her community and bring those people from her home, her network circle, and network circles into our gatherings to say that I need your support, and I need you to learn about breastfeeding. Not just the father, but the grandmother, the best friend, the neighbor, and that's what we're seeing with our community breastfeeding.
Well, we have a caller on Fresh Start Today. Do you have a brief question or comment related to this particular topic?
Yes, I do.
Yes. Go ahead.
Yes. My name is Donna Smith, and I am a member of Alpha Kappa Alpha Sorority. And we are in the midst of partnering with the African American Breastfeeding Network through Dalvery to help provide some resources to the moms. And I thought that it would be a good idea if Dalvery could just kind of state to the community what are some of the needs that our moms out in the community that's breastfeeding would need.
Okay, thanks a lot, Donna.
So breastfeeding needs, a mom, the number one need that we feel moms need is a community of support, a place where she can come and be heard and ask questions and be supported. Oftentimes, mothers do need basic things for their babies. We do give out like baby T-shirts and blankets and whatever those other kind of basic needs that mothers may have. But all mothers, most mothers will pump at some point, and that's one of the first questions we get asked is, where do I get my breast pump? And through the program that Donna Smith mentioned, we are hoping that we can get some multi-user pumps or pumps that we can actually donate to mothers, because the Affordable Care Act does cover a one-time pump for each mom under that policy. But
and how much are they if
the average
it malfunctions,
is like
it breaks, or
to replace it? I mean, to buy a new one, $200 to $300, a really good
wow.
one. And you can imagine most moms can't afford that. And we encourage hand expression, so we show all of our moms how to hand express their milk in the case that they don't have a pump. And some mothers can get more milk through hand expression, believe it or not.
So my question, and that's great information, how important is breastfeeding for the baby, for the mom, for the father? How important is breastfeeding?
So we know that many organizations like CDC,
Center for Disease Control.
Center for Disease Control, the American Academy of Pediatrics, the World Health Organization has declared breastfeeding a public health issue.
Why?
Why? Because of the benefits. And the benefits are not just throughout the duration of breastfeeding, but it's lifespan, it's lifetime benefits. You mentioned early reduction in obesity.
Okay.
Reduction in cancer, ovarian cancers for mothers who breastfeed. Babies have less allergies, less spit ups, less sudden infant deaths.
SIDS, which is important. Yeah.
SIDS.
So breastfeeding can reduce, or has shown to reduce, sudden infant death syndrome.
Yes.
Infant mortality.
Absolutely. And the breast milk is perfect for the baby who's born early. The baby who's born early needs certain nutritional values like iron in their milk, for example. Breast milk for the premature baby has everything that the baby needs. Now, mind you, some babies do need to be supplement with a NeoSure for babies who are born early and who are very sick. But mothers who give their babies breast milk when the babies are born early or premature are released from the NICU much quicker than babies who are exclusively breastfed.
They are released from where?
The NICU.
The NICU. What is? See, you're talking to men.
Intensive care
Oh,
unit.
okay. See.
Yeah. I feel like we're just having this conversation at my office. So I'm using
no
the
problem.
NICU, and so we have our breastfeeding peer counselor Kim Hamilton, who I hope that she's listening, and Nigeria Nilly is another breastfeeding peer counselor. But both of their babies had spent time in the NICU, and they both exclusively provided breast milk. So when your baby is in a NICU, we have to understand, gentlemen, that the baby is too young or not healthy enough, not strong enough to come to breast, right? So the mothers have to express milk in the hospital and feed it to the baby. In Kim's case, the baby was tube fed instead of bottle fed with her breast milk, because they didn't want to confuse the baby with bottle feeding and breastfeeding, which can be very, if you try to do both of them at the same time, which is an issue with teenage moms. They want to bottle feed with formula or breast milk, and they want to breastfeed too early, and too early is before 4 weeks.
So why are you finding that, or the research is suggesting that teen mothers are less likely to breastfeed than older mothers? What are some of those factors that influence that decision?
Their life experiences,
Okay.
their worldview, especially Western worldview of baby and mom being together, for example. I had done some research on this because I knew that you was going to ask this question. So I want to the person that, when I had done some research, Cynthia Majab, she's a good friend of mine. She lives in Linwood, Washington. She's an author and advocate around this issue. And I really like how she frames this, the cultural norm of breastfeeding as it relates to teenagers and young people. So I would just like to share some information about why teenagers or younger people may not find breastfeeding attractive, for example. So if we look at the mother and baby relationship, many young people have a very individualistic value of independence. Independence is really high. They want to, go on with their life and go back to school. And we hear this with grandmothers as well. So teen mothers see the mother-baby relationship as two separate individuals in need of independence from each other.
Okay.
How often do we hear that? I don't want to breastfeed because I want my mom, my aunt, my neighbor to feed my baby so that I can do X, Y, and Z. We support going back to school, education, working, but we also understand as a community to grow our healthy babies, to have a wholesome community, that mothers do need to spend especially those first couple weeks at home with baby, nurturing babies. If I had my way,
the teen mother who's in school,
But school, 6 weeks is what I think they are. 6 weeks is what I think the Milwaukee Public School allow them for so-called maternity leave. But we're working with Milwaukee Public Schools this fall to make sure that those schools that target teenage moms have lactation spaces, so that at least the mothers are getting the breast milk when the babies are getting the breast milk when they're away.
All MPS schools don't have
lactation spaces for mother to express their milk.
And lactation spaces is simply what, for the man that's listening and one you're talking to right now?
Well, lactation space, what the law requires and what we see federal language, is just a space that is required
at an employer.
At an employer, at a school. Yep. I mean, honestly, we're trying to get public libraries to have spaces too, because that's really important when we start talking about things that we can change, systems and policies in our community.
They have them at the airport.
At the airport, they have them at the airport. They have even at some restaurants we know are comfortable with that. But with teen moms, what they're very uncomfortable with, what AABN has learned over time and working with this population, is the noise.
What noise?
The noise of the motor of the pump. The motor of the pump when they're expressing their milk. When I was doing worksite visits, and I would visit some of the mothers in their work sites, and I was taking pictures and interviewing them for the work that we're doing. I was very surprised to see that they had the manual hand pump instead of the electrical pump that they got from their insurance or from WIC. The electrical pump allows a mother to pump both breasts at the same time. Therefore, it
saves time.
Time. But she was using the manual pump, and I met several mothers like this. And when I asked, why are you using the manual pump and not your electrical pump in your lactation space at work, which your employer or school, they provided you space to do this, she said, because of the noise. It's kind of embarrassing, and people knew what I was doing. So teenagers are really.
Why is breastfeeding embarrassing?
No, but she was pumping. She wasn't breastfeeding. She was actually pumping. She was pumping.
But it's still part of that whole.
But when I'm glad that we're talking about teenagers, because that's the population that is it's challenging to reach because they are totally disassociated with, like I said before, sometimes with the mom and baby dyad, and really what does it mean to really care for a baby.
And Dalvery, I think to add to that, because some of the research that I did out of North Carolina, it speaks to some of the same statistical data that you mentioned, and that significant drop when children do leave the hospital. And I think it also speaks to when you mentioned it takes a family and or a village to get children to buy into breastfeeding, because whether it's the child's father, the aunt, the mother, grandmother, whomever, we have to get kids or teenagers to buy into that, hey, this is a collective thing, and change that mind state of that individualistic mentality.
Absolutely. I think we have to, as a community, send messages that breastfeeding is normal, even for a teenager. Now, in our community, my mom always taught me no pregnancy is a mistake.
Wow.
That's just how we was raised. My mom is very pro-life. She doesn't matter what age. So in that vein and in that frame of reference, working with teenagers in breastfeeding, I think is more important to wrap our arms of support around them, to say, we're not saying that we don't want you to go back to school. Of course we're not saying that. We're not saying that you're not going to be a good mother. But providing those resources and support to let her know and the families know that breastfeeding a baby is the most important thing that any woman can do at any
All
age.
right, thanks a lot. Now, we're going to take a break right now, and after the break, we're going to continue this conversation around the importance of breastfeeding, or the benefits of breastfeeding for both the baby and young parents. Right after this, you're listening to Fresh Start Today.
Do you know what Nelson Mandela, Andrew Jackson, Malcolm X, and Steve Jobs have in common? Each of these individuals were world leaders who were once in foster care. We often hear about the road from foster care to prison, but did you know there's another road from foster care to a world stage? Fresh Start Family Services is looking for adults to become licensed foster parents. Every child needs a caring adult in their lives. Wouldn't it be great if you could foster or adopt the next world leader? For more information on how you can become licensed with Fresh Start, please call 414-351-1100. That is 351-1100.
Good afternoon. You're listening to Fresh Start Today. I'm your host, Jermaine Reed, and we have in the studio with us Dalvery Blackwell from the African American Breastfeeding Network, located right here in Milwaukee. We have the blacksmith himself, Dr. Ramel Smith, and Sean Roby, and we're talking about the benefits of breastfeeding for the baby, for the mama,
Let's keep
and
talking
the
about it.
daddy. This is a very important topic, and I'm learning about lactation space. I've learned about engorgement. I've learned about cracked nipples, all that kind of stuff. So it's a very interesting topic, but we also want to talk about some of the disparities. And my question to you is how soon after birth should a mother start breastfeeding? And then what are some of those things that lead to them, and when should they stop? When should they stop breastfeeding?
Okay.
So when they should start, when they should stop, and then also bring into a historical context how important breastfeeding, or the role it has played in our rich history. So, Dalvin?
So, research shows that babies need to be brought to mom immediately after birth, just as it was from the very beginning. We never had these interventions where the babies were swept off to a warm or anything like that, incubator or anything like that, or wiped off or anything like that. So the baby should be brought immediately to mom, skin to skin, and skin to skin is no clothing barrier, immediately after birth, and kept close to mom for the first hour. For the first hour. And what you will see with many babies, they will find breasts. They will search for breasts, and they will use their motor skills to search for the breast and latch and do self-attachment or self-latch on to the breast within that first hour. And I know that was
it
It's an innate reflex.
Right. Babies are born to breastfeed. They know nothing of bottle nipples and pacifiers and bottles. They want to suckle. And that skin to skin excites them and get them ready to do just that. So skin to skin is very important. We encourage all of our moms to do skin to skin, not only immediately after birth, throughout the duration of her hospital stay, and when she gets home, especially those first 7 days, because that's kind of when some challenges will start occurring when mom gets home.
Challenges?
Some of the challenges will be thinking about house chores, for example.
Okay,
Something
how do you
simple like
balance all of
how do
that?
you
Yeah.
balance all that, caring for the other children, the stress of going back to work or school, not feeling the type of support and that she may have had in the hospital, not knowing who to call, and then, just not breastfeeding regularly on baby's cue and understanding that.
But some of the other challenges, we're definitely going to get into the historical piece, and Dr. Smith was saying some very important things over from a cultural context when we were off air, and hopefully we can have him share those details. But when you start talking about some of the challenges, you're saying just the scheduling, balancing your duties and responsibilities when you're back at home and you're not in the hospital.
Not having social support. There's
Not
so
having
many.
social support. Okay.
The stigma around public breastfeeding. I visited moms.
But what
who-
is the physical effect does breastfeeding have on mothers?
What are the benefits
sleepy?
for
No,
moms?
I'm talking about the physical effects. I mean, do they get tired? Do they get, what
No,
happens with a woman when
a
baby
woman
is
when a
breastfeeding?
woman breastfeeds, for the most part,
Yeah,
and for many women, they're empowered.
they're empowered.
They're empowered.
So-
There's a hormone called oxytocin,
Okay, and
and
oxytocin,
oxytocin occurs in the bloodstream whenever moms breastfeed, and that gives her a relaxation and comfort and peace, and that's what many men find very attractive about breastfeeding, because not only is she caring for her baby in a very natural way, but she's very calm. I'm sure my husband loved it.
So
I
you
sat
mean
down.
that breastfeeding impacts the behavior and the attitude
Of
of
a
African,
a mother.
African American women
Yeah,
or women,
mothers,
period.
yeah, period.
So
They can
it's
be
beneficial.
It's a oxytocin is a hormone that makes her feel really relaxed and very confident about what she's doing and the way that she's being with her
wow.
baby. And that is one of the number one reasons why I fell in love. I tell mothers all the time, when we're not sitting down and caring for our children, what are we doing? Cooking, making groceries, washing dishes, visiting folks. We're busybodies. So breastfeeding gives black women an opportunity to really sit down, bond with their baby, be with their
Calms
baby,
them down. I'm
and
stuck right there.
totally relaxed. Yeah,
Nice and
I
nice
I
and
love that aspect. of
Sharing
it.
and nice. I
Yeah.
like that.
And men
Okay,
notice that, and they're
so
like, "Oh,
from
my
a
wife
cultural,
is really nice today. I gotta
Let me
make
ask you a
sure."
question
Power
on that for the
breastfeeding.
opposite, because sometimes ladies will go through postpartum blues, postpartum depression, and whatnot
Okay.
like that, where they don't feel the attachment to the baby, and there is that disconnect. What are some suggestions that you have for them?
The first thing that they should do is seek medical advice when they're feeling sadness or disconnection with their babies. If mothers, particularly if they're breastfeeding their babies, it's very important that they seek help and get some therapy and some perhaps medication to deal with postpartum depression. But there is research shows that breastfeeding actually reduces the risk of postpartum depression.
okay.
And I've worked with many women who had postpartum depression formula feeding, but she didn't have postpartum depression breastfeeding her second child.
I think to add to that, when you talk about that first 7 days, which is so critical in term when you're talking about the parent and that child, there's a very deep bonding that also develops right there, because it continues that relationship that child had inside of the womb, now outside of the womb.
That's a very good point, and that's the message that we need to continue to share with mothers, that it's a biologically the natural way of being with baby and continuing that connection with babies.
That vibration.
We're the
and
only
everything else.
species, when you think about it, that this is really an issue. You look at pigs, you look at horses, you look at dogs or whatever. They're right attached to their mother right away, and they're feeding,
right.
they're getting the milk.
Okay,
And
yeah.
we humans, the most evolved, we go to the cows to get human
Yes.
milk. So when you think about that,
Wow.
what would be best for a human but human milk?
But that's a very tough message to sell to or to convey to teenagers, because they're so individualistic and
Oh,
they're
no
so, yes, I had a baby, but I have to do this, I'm going to do this. They don't understand the value of just being with baby and caring for that baby, and because they don't see that as doing something valuable. They don't see that as they see that as that's going to slow me down.
I think that
That's
goes
gonna
into the
interfere with my
education portion that you talked about. And I think we need to start this well before they're in the puberty age, as far as talking about it, so it becomes a norm. We talked about from a historical relevant standpoint. So many times when people would see it, they would think it was nasty because that stigma
You
was
talk about
attached
the
to
roots,
it,
yeah.
instead of understanding how beautiful it was. We kind of talked about off air kind of in a joking way, but it was very serious when the series Shaka Zulu came out, and it exposed us to a lot of our native African culture. When when the young girl saw the women walking around with their breasts exposed, it was like, ugh, that's nasty. And it was like, it was nothing nasty about that. It was beautiful. And it was like you were saying before, so it's like, well, when it's empowering, they said, this is a source of life. This is something that's beautiful that we give, that we take pride in. This is something that is the essence of life. And when we look at our Muslim brothers, you know, they always talk about the mother being the first teacher. Well, that first teaching comes from supplying the brain. We talked on this show many a times how those first 5 years of life are so critical for brain development. So when we start talking about getting in the proper nutrients, those are the things that we need. When we talk about special education, some of the things that our kids go into, well, why is that? Because if you breastfeed, we said that it reduces the likelihood also of otitis media, which is ear infections. Because when you have ear infections, you have speech problems.
Absolutely.
You can't hear clearly, so you don't talk clearly. There's delays that's coming there. So when we start talking about some preventable delays, we think about all of the benefits of breast milk, and it's right there. And I mean, the number one thing when we talk about a depressed economy that we have, it's free. I mean, it's right there.
And
we're paying for something worse.
Right. And when we talk to fathers, we have a father peer advocate, Robert Brox. When we talk to fathers and throughout the years that we've been doing this work, well, we hear from fathers all the time, I want my baby to breastfeed because of bonding, brain development, and it saves us money. Those are the top three reasons why they want their baby. So it's brain development, that breast milk has fatty acids that's good for the baby's brain, that helps develop the baby's brain, and eye development, the bonding that occurs between the family. Sometimes, I mean, we think that bonding just occurs with the mom and baby diet, but it's honestly, when you see it and when you look at it, it's engulfing the entire family. I mean, it's really bonding for the fathers come closer because they feel attractive, more attractive. They feel more supportive that, oh, she's not out running the streets, quote unquote. She's here with the baby. She's taking care of my baby. Now I can go out and provide for the baby because I know, I'm confident that she's taking care of my baby.
So how are ways that fathers can support breastfeeding?
What I would suggest that fathers do is to take a class. Take a class, preferably through AABN with our breastfeeding.
What are you going to teach me if I come? What should I look for when you?
Well, when you come, the topics are different. They vary from each. We have 3 topics that rotate 3 times a year, and I think I heard the first 7 days is going to be our topic in September. It's called Getting Your Baby Off to the best start with breastfeeding, and is presented by a hospital lactation consultant. So guess what? The men can ask, well, what do I expect after birth? Can I cut the umbilical cord? After I cut the umbilical cord, when should baby come to breast? How often will the baby needs to feed? Will the baby room in with me? Will I see breast milk? Will breast milk come out? When will we get, when should we hand express, or questions like that fathers can ask during those first 7 days. When I get home, what should we do? Should we continue to do skin to skin? How often will the baby need to be fed?
Well, let me say something, because I still want to learn as a father when I come into a classroom. I mean, what are the skills that I can expect to be taught? And what can I do to support my girlfriend or my child's mother? But when we think about teenagers, typically they are living in 2 separate homes. So it's really important to have those parents of those particular teenagers to really work together to come up with a support, or a schedule that can support this father being engaged and involved with that child, because the child does not only have one parent, but he has or she has 2. So, but then there's the other, they have 2.
I like what you're saying, because we identified that as a serious barrier that we need to address right away. So what we started to tell the mother and father is that there's no baby separation for 4 weeks.
No baby separation.
Where mom go, the baby's going. Because oftentimes,
what about daddy, though? Because we're always leaving fathers out.
Oh, daddy goes too. Daddy picks moms up and take her by his uncle's house, or take it by the grandmother's house. So the father is always there supporting the mother with the baby and the mom. So the first 4 weeks, we recommend exclusive breastfeeding, skin to skin.
For the first 4 weeks.
For the first 4 weeks.
No
pumping,
no mixing, no hand.
Well, hand expression is fine, but it's not necessary unless you want to just get extra out because you may be engorged.
But what if your breast malfunctions?
Like if you have a
inverted
surgery.
Breast, I mean, not inverted breast, but
inverted nipples.
And other issues that might be going on with breasts.
Making sure that you have access to a lactation consultant. There's not many women of color who are lactation consultants in the country or in the state. I think I'm the 3rd or maybe the 4th woman of color with International Board Certified Lactation Consultant credentials. So making sure that she has access to women who have the experience to deal with breast engorgement. Or like one time we went to do a home visit, and the doctors recommend supplementation with formula.
Okay.
And so when when we did the home visit, we were like, okay, let's see the baby at the breast. And it wasn't until then that the mom told us that she had a breast reduction.
Okay.
Her breast
So how does that
reduction.
not only breast reduction, well, yeah, people enlarge their breasts, people reduce their breasts. How does that impact?
It can impact. It can impact milk production and
Really?
the production of milk. Absolutely. So that a mother and babies watch very carefully. Weight checks are done on a weekly basis. She's asked to come into the doctor's office to see if the baby is gaining weight. She might supplement, or she may do. She may pump her milk out and put it in a bottle. She may do, so.
All right, you're listening to Fresh Start today on 860 AM WNOV. I'm your host, Jermaine Reed, and we're talking about understanding the benefits of breastfeeding for parents and for babies. And so if you would like to join this conversation, please call 414-444-5250. And, if you would like to provide foster care services, you can call Fresh Start Family Services at 414-351-1100. Now, I need to ask you, in terms of some of these risks that are associated with breastfeeding, if a mother has a disease, if a mother is sick with a cold or flu, if there's drugs in the equation, can we talk about those things that can be a risk factor for a baby if a mother wants to breastfeed, but there's some other issues going on?
There's few risk factors.
Okay, what are they?
But there's few, but
Okay.
I like to just share a few of them. HIV. In the United States, it's suggested and recommended that babies are not breastfed if the mother has HIV.
Okay.
We talked about breast reductions. If the mother has had a breast reduction and a large amount of her breast tissue is removed and she's been cut up, she probably has low milk production. But usually 100% of issues that come up with breastfeeding are preventable, and there's not a lot of risk associated with the mother not being able to breastfeed. There are a few mothers that may naturally have low milk production because of the anatomy of her breast. So in that case, hopefully she's working with someone that will help her pump milk or get a supplement with formula if necessary.
Okay.
I think I want to add to that. That's why it's so critical when a person, it speaks to the value of being healthy and eating healthy, because, and you can correct me if I'm wrong, Dalvery, what a parent takes in, that child is going to receive that through breastfeeding in terms of what that parent is eating.
Yeah, I hear this question often by the women and families we work with. Does diet play a place? Does diet affect milk production?
Okay.
And I like to really think about this and address this from a global standpoint, because we really don't want mothers to end their life, things that they like to do in their life just because they're breastfeeding.
Okay.
Their life should continue to be normal. First of all, we want mothers to have a healthy diet, to drink lots of water, to be well hydrated, to eat raw foods. But if we think about this globally, and we look at women in China, they're not going to stop eating rice because they're breastfeeding. Or we look at women in Africa, they're not going to stop consuming hot peppers because they're breastfeeding. Babies naturally will acquire a taste of the culture foods that we consume. And so when it's time, they will adapt to that food very quickly. So what the advice that I give to mothers is, you want to eat, you want to consume things in moderation. Yes, you can have a soda, but you don't want to have 2 sodas because that's too much caffeine. Or you don't want to have 1 soda and 1 candy bar in one day because that's too much caffeine. But they can have soda or a bag of chips, but everything is in moderation. I would never tell a mom, well, you have to stop eating hot flamings because you're breastfeeding. That's the wrong message that we need to.
But what about these young folks, especially in foster care? We see a lot of young children who are on medications, psychotropic medications. So what if they're taking medication, even adults, on...
According to Dr. Hale's Breastfeeding and Medications, 90% of all medications are safe for breastfeeding. Again, we need to make sure that our families and our teenagers are getting adequate and access and adequate care by providers, that they're seeing doctors, and that the doctors are informed and educated about lactation. That's one of the issues that we're seeing nationally and even locally, is that many of our doctors don't have the experience with lactation and understanding breastfeeding and medications to support mothers. So
there's something I definitely absolutely want you to talk about, because when I'm thinking about foster children, I'm thinking about the history of slavery in this country and breastfeeding, the trauma piece. How does trauma impact breastfeeding for mothers and the child, a history of trauma?
Yeah, so when we look at slavery as the historical perspective in history.
Or the young girl who's been sexually abused by uncle, by daddy, by trauma.
Trauma, when a woman has been violated, whether, historically, we know that during slavery we was violated, raped, everything. That plays a large part in her perception of herself, caring for herself and caring for others, and definitely giving birth and being connected naturally to that process of birth and caring for a child. So that type of trauma does negatively impact how we not only breastfeed, but how we care for each other, human beings, and how we see that our babies connecting to us. We talk to a lot of women who tell us, I don't feel comfortable breastfeeding. And when they tell you that, that is a red flag or cue that they probably has been sexually violated. So then we come from the angle of breast milk in a bottle is better than formula in a bottle. So would you consider pumping your milk out and then working with the mom to perhaps figure out how that will work in her life, expressing her milk?
And just from a trauma standpoint, I think what we have to do recognize is just like from a realness standpoint, once a young girl has been traumatized in that manner, her body becomes a lot different for her. She doesn't see it in the same way. And when she sees the baby, I think that goes to the point you were making, Sister Blackwell. That's a red flag that she might not care for the baby in other different ways. So I might not feed with the bottle, whether it's breast milk or formula milk. I might not change the baby. I might not do that. So one of those things that's a natural connection to the baby, if we can't see that relationship and bond foster, you talk about red flags, not just for breastfeeding, but for all type of care with the baby. It's a big indication. And that's where we go back into some type of form of therapy, not even necessarily like with a professional, but with some help to help ease that, so somebody can help her or make sure that they help the child specifically until she is ready or able to do it, to make sure the child is safe.
Yeah, and there's not a lot of research and information around trauma and breastfeeding. And I certainly would like to explore that area in terms of helping mothers who have been traumatized to look at breastfeeding as an opportunity to heal.
Okay, so it could lead to some neglecting some other areas of what
Oh,
doctor.
definitely.
Okay. Caller, you on Fresh Start today. Do you have a brief comment or question?
Yes, I have a comment.
Yes.
I was just calling in support of breastfeeding. I'm a mother of 5 children, biological, and 2 I have that are stepchildren. But I'm supportive of breastfeeding. I breastfed all of my children for 2 years straight. And I love the benefits. I love the bonding, and it's just amazing. That really in support of AABN, and I love what they're doing, and I love for them to be trying to reach out to the younger generation, because it is difficult for them to understand how beautiful and how important breastfeeding is.
Yes.
And I just really love what AABN is doing in support of trying to encourage those young mothers to breastfeed their babies, because it is important.
Okay, you know, one thing I was reading. Thank you for calling. I was reading something that was talking about how that some folks in certain countries practice extended breastfeeding, and so when we start talking about initiation and discontinuing breastfeeding, there's folk who are breastfeeding their children at 15 and 16 years of age. What's going on there?
That's rare. I mean, that's a very few population people who are doing that.
But what's the thought process behind that?
I'm not sure. I haven't done, to be honest with you, any research or investigation around and looking up why they extend it. But we do know that breastfeeding, like a 3-year-old, 4, 6, 7, is kind of the global norm.
3 to 4, 6, 7. So can it be part of a cultural piece? So even with the 6, 7-year-olds, because I see, and this is just my opinion, I don't see African Americans in general breastfeeding their kids at 5 and 6 years of age. I'm not aware. I've seen
Few.
maybe like 3 years. When I see 3 years, I'm
Few.
like, nah, that boy, he too big to be sitting up there.
You know, you have to be careful because that can create some enmeshment problems where, like, you know, we kind of use the saying, get the titty out the boy mouth. Sometimes that's the
He's
literal.
60 years
Sometimes
old.
It becomes an age where you say, especially in a hypersexual society that we live in, like America, where you say, okay, well, where does this become some type of child abuse or whatnot like that, where you have to help them? I'm not saying there's still not benefits, but once you get to the age where this kid is walking and running and eating other healthy foods and things of that nature, where we don't need the breast milk, we got to remember breast milk.
But why are they breastfeeding? That's what we have. That's the discussion we have to figure out. Is why do babies, which both of my children still wanted to breastfeed me
At what time?
1, 2. I self-wean. So self-wean is when a family decides together, and only a family can decide, not society,
Correct.
when we're going to wean this baby. And my husband and I decided that we were going to self-wean. So self-weaning is caring for the baby, offering breast, and usually by 1 year old, a baby is breastfeeding 3 times a day, morning, noon, and at night. That's it. When we think of breastfeeding an older child, unfortunately in America, we think that the baby's nursing all the time. We need to break down that stereotype and that misinformation, because the baby is not nursing all the time.
Okay.
The baby is nursing occasionally. The baby may nurse once a day. Why is that? Why is that? What research shows, and what I found personally, is a reconnection back to mom.
Okay.
It's
So you can't just hug?
Well, you can hug, but in that it's once you start breastfeeding a child.
Because we got about 1 minute left on the
That's
show,
okay.
and Dalry, we just have to have her back. She should have been on here 2 weeks in a row because it's a very important. I know she was. It's something about talking about breastfeeding that just get us going. But let me say this. For those individuals
I'm
who
gonna bring a sister with me too next time.
Next time, yes. And bring a Hispanic one. Bring a Caucasian one, so we can see from their different angles, perspectives, where the value of breastfeeding comes in. But for those individuals who own group homes and foster parents who have teenage mothers who are pregnant and have babies, is there anything that we need to take in consideration when supporting that particular population of young mothers?
I think that the entire family, the individuals in the group home,
The staff.
perhaps the staff and the families, the girls that's in the group home should have discussions around breastfeeding, regular discussions around nutrition and breastfeeding and parenting and all those type of issues. But breastfeeding should definitely be at the core, in addition to getting education together, so that they're hearing the same
and
thing.
you all can serve group homes if they contact the African American Breastfeeding Network,
Yes,
and
we
you
would
can go
love
out
to
and do
come
some
out
training
and
sessions. All right, you've been listening to Fresh Start today. I'm your host, Jermaine Reed, and we'll be back next Wednesday at 3 o'clock p.m. Until then, be safe and be well.